I've found as a clinical observation over 30 years of practice that the main reason people have digestive constipation or slow motility is because of yeast overgrowth, because of candida. So here's a research paper where they're looking at inflammation and gastrointestinal candida colonization. There's other yeasts, there's other molds that can colonize the gut, but candida is definitely one that we have as part of our normal biome. But if it overgrows, then it's problematic, and it's the most common one. So what they're saying here is that candida organisms commonly colonize the human gastrointestinal tract as a component of the resident microbiota. Their presence is generally benign. Recent studies, however, have shown that a high level of candida organization and colonization is associated with several diseases of the GI tract. Further, the results from animal models argue that candida colonization delays healing of inflammatory lesions and that inflammation promotes colonization. So that's the key. That's the key of what we're looking for here, is that in the animal models at least, they're saying that the candida itself, the colonization of it, the overgrowth of it, right? Not your normal amounts, but the overgrowth of it delays healing and promotes more colonization. So it's kind of a vicious cycle, right? Because if it's entrenched in there and surviving and very happy, which it tends to be once it overgrows, because it's got a perfect place to live, right? It's dark, it's warm, it's wet, and it's got a constant food source. Perfect. So if it has the opportunity to take over the space of some of the bacteria that are supposed to live in the colon, then it certainly will. And what they're saying here is that the colonization is associated with elevated levels of pro-inflammatory cytokine interleukin 17. So possibly the interleukin 17 is the pathway that it uses to colonize, enhance inflammation, and because it's a frequent colonizer, to have this impact on many people. So if we are slowing down digestion because of that inflammatory impact of candida, then that would make sense to me that that's a reason why people get more constipation symptoms. And if you tie in my treatment with sulfur, with the GI1 powder to this, and we're actually eradicating fungal species, because that was its original intent. It's more than that at this point, but that was the original intent, is looking at fermentation species, which are yeast of fermentation species. They produce carbon dioxide. When you are making bread and you pound it down and you set it to in a warm place to rise, that rising is gas, right? So that's what they do. They produce gas. So when I have a patient who is complaining of constipation and gas at the same time, I'm absolutely going to use the GI1 powder, because that can actually directly and indirectly get rid of both problems, or at least along the lines of the constipation, depending how old you are, because wear and tear, I'm right there with you. But, if we can get the problem improved at least and get rid of that gassy, bloaty symptom, then you've really hit the cause of the problem and solved it.